Good morning, good afternoon, good evening, whatever time it may be. This is Molly Norton. I'm the Executive Director of Quality and Experience at Silver Hill Hospital. And today I'm joined by a very special guest, Dr. Jess Zonana. Jess is here with us today to shed some light on a very important topic, which is stuttering. It is National Stuttering Awareness Week from May 12th through the 18th. And Jess is going to cover some very important ground with us today and hopefully connect with some people out there who may be struggling with stuttering and the many impacts that it can have on people's lives. So Jess, thank you so much. Welcome.
Thanks for having me. I am a psychiatrist. I joined Silver Hill at the end of 2021 as director of outpatient services. Until then, I was at Weill Cornell Medicine, heavily involved in residency training and teaching as through my role as chief of adult outpatient services there. I started stuttering at the age of 8, which is relatively late. Most kids begin anywhere from ages of 2 to 7. And I have participated in speech therapy on and off throughout my life.
So what causes stuttering in people? For those who don't know kind of the etiology and what makes it happen.
Well, as you might imagine, the specific cause remains unknown. We have learned a fair amount about contributing factors. Stuttering has a hereditary component, with some studies reporting that genetics account for 50 to 80% of stuttering.
That's pretty significant number.
Yeah. The other major approach is that it's thought to be mediated by dopamine, and so there's been some genetic linkages shown to those genes, but there hasn't been one specific gene identified. And interestingly, none of the medications that we have that impact the dopamine circuits have had any real dramatic impact on stuttering.
That's so interesting. And I was going to mention dopamine because dopamine comes up in our work a lot, like
yes.
The influence of dopamine.
Yeah.
And so in stuttering, is it too much dopamine, too little? Is it not even the amount? It's just...
I think we don't know.
Okay.
Stuttering does have some commonalities with Tourette's disorder, Tourette's syndromes, I think it's best understood by me, at least, as a movement disorder. I think that sort of helps to describe sort of the experience of involuntary movements and dysfunction of timing and coordination of those speech pathways.
Interesting. So in terms of the psychological impact, can you speak a little bit to what people who stutter go through from a psychological standpoint, and if there's any risks involved with that?
Yeah. I mean, I might back up because this overlaps with one of the EE misconceptions,
okay.
Which is, many people believe or think that it's caused by anxiety. Anxiety makes everything a bit worse, and so there's no exception here with that. But you can't treat stuttering by treating anxiety, and I think that's an important thing for people to know.
Right. So even when you're completely relaxed, it's not like it goes away when you're completely relaxed.
Yeah.
But anxiety can make it, can amplify it, I guess.
Yeah.
And, for people who don't stutter, I think everyone stutters a little bit, in human speech, there's there's always something, but interesting how people who don't stutter when they are really nervous can have some of those. So I think that's probably where some of that misconception comes from.
Yeah, exactly. And to jump to your question about psychological impact, I think in a way the most painful part about stuttering isn't the actual disfluency. It's everything that sort of results from that, from the involuntary sort of behavioral struggle that your body sort of instinctively mounts, and then over time, the impact it can have on social development, social anxiety, and that can create a sense of isolation for people. Adults who stutter have a increased risk of developing social anxiety, and twice that risk of mood disorders.
Wow.
Which isn't inherent to the condition itself, but the sort of cumulative
downstream effect. Yeah. And for kids, I imagine there's probably bullying and other kids who don't understand, and that can have an impact too psychologically on kids, teens. I mean, I imagine that's for adolescents, it's probably an especially difficult period.
It's a tough age to have anything that's very obvious
and that makes you different, right?
Or an obvious vulnerability.
Right.
Absolutely. Many kids will their stuttering will resolve, but there's a small percentage of those who continue to adulthood, and again, we don't know how
science explain that. That's so interesting that for some people it just goes away.
Yes.
But why doesn't it go away for everybody?
Yeah. But even for the kids that it might go away, it's important to have speech therapy as well, if it's sort of at all persistent during childhood, just to help manage the other effects of it too.
Yeah, and that kind of leads into my next question, which is treatment. So if someone develops a stutter and wants to try to help themselves to overcome it or have the best chance of overcoming it, is it really just speech therapy that is the option? Is there anything else that people do or try that can help?
I mean, lots of people try lots of things. I mean, I do think speech therapy is the mainstay of treatment, and the approaches to speech therapy have really evolved over my lifetime. Early on, it was, pretty much focused on fluency training, so retraining yourself how to speak, basically.
Mm-hmm.
And that would have some positive short-term effects, but everyone would see improvement, and then it would sort of go back, and that was sort of painful, I think, also where you get this hope, and then all of a sudden it's going back, and then it feels like your fault. And so, but now the focus is is more on management and how to sort of minimize all the sort of secondary effects that result from the disfluency. And so, and that really helps empower people to have more comfortable social interactions.
Yeah.
Things like maintaining eye contact, which are, is hard when you stutter, sort of instinctively.
So it's almost like it went from being just really speech focused to kind of the whole person and their psychology too.
Exactly.
And that's really fascinating.
Yeah.
Is there any particular form of the speech therapy treatment that you found to be especially like interesting or helpful, or like a skill training or anything like that might be interesting for people to hear about?
Yeah, it's an interesting question, and I think everyone sort of attaches on to different things. For me, it was kind of learn how to make the involuntary a little more voluntary, so that if I hit a block, I learn how to back off of it a little bit, as opposed to push through, because your body wants you to push through it, but you have to sort of learn to back off of it.
Like rein yourself in a little bit.
Yeah. And the other interesting approach is called voluntary stuttering, which I'm not using right now. That was involuntary. But it kind of interrupts your speech pattern a bit, so that it just disrupts a bit your sort of usual pattern of stuttering, which is helpful.
So you're intentionally trying to kind of...
So I would voluntarily like extend a syllable.
Okay.
And it's hard because you can hear it sounding a little bit weird, but
but other people probably wouldn't pick up on that at all.
As much, yeah.
Yeah. So talk to me a little bit more about your own experience and what you think could be helpful to others. Like if you were talking to a group of people who, kids, adults, whomever, that stutter, any knowledge or wisdom that you would want to impart, because you're also a psychiatrist. So you're in this unique role of someone who has this lived experience of stuttering, and also understand a whole lot about the brain and psychology and how people work. So lay it on us.
Yeah. I mean, a few angles to this. I think the more openly everyone can talk about it, the healthier for that person. So parents, it may be easier for you to bring up and not wait for the kid to bring it up. Well, I would edit that for young children, but if you have a teenager, it can be helpful just to learn how to talk about it openly and non-judgmentally, ask about it. I think it is important to address any mental health results that result from it, because those will get in the way of you being able to sort of manage it in a healthy way, improve social relationships. And obviously for everyone it is different. Some people it might not bother them that much. For others, and depending on how severe it is, it can be a huge effort each day to get through your day. So.
Right. And I imagine people can seek kind of avoidance and
exactly.
isolation and just not having to deal with it by not being around people. Because if you don't have to talk to anyone, then you don't even have to really think about it as much. Which can be, I imagine, incredibly isolating.
Yeah. And I think the other important thing is it does change over time. And I mean, to borrow a phrase from my other tribe, like it does get better, and it's often hard to sort of see that in the moment. You learn to manage it. You learn how to survive embarrassment, which is helpful in other realms of your life as well.
Right, it's like exposure therapy all the time.
But you have to do it often enough that it's actually exposure therapy and not just got through that one.
Right. Right. And at this point, do you feel like you have to consciously still every day kind of push yourself to put yourself in situations where I mean, you're here now, which is amazing. Like, not everyone would volunteer to come on a radio show, when they have a speech difficulty. But
no, I mean, it's changed a lot for me over my life. I mean, how it is now for me is like worlds different. It occupies a much smaller place in my my everyday than it had once. So, I mean, radio show is a little challenging for me to agree to, but like most other things, I just sort of know how to do, or at worst get through if I need to. So
right, and I think that's really inspiring to anyone who's listening, right, who might be struggling. Like this has not stopped you from doing what, having a wonderful career and being successful and being social and having friends and all the things that I think people probably worry a lot about when this happens to them at a young age. So I think just the fact that you're here and talking about it is inspirational. Yeah.
And the other interesting thing is that, you may not know what will help. So like, going to a med school and being a doctor was sort of accidentally the best thing I ever did for stuttering. Like, if I had known how often you had to present orally like every day in med school, like I might not have done it, but I didn't know, so great. And then the other thing was really embracing the doctor role in a individual interaction helped, because all of a sudden, like, I had to make sure that I was making things as comfortable as possible for the patient, and so it led me to be very explicit about it up front all the time, and doing that over and over and over just changed sort of how I approached interactions, where it was like, okay, it's my job to make them comfortable. It's not their job to make me comfortable.
Right. That's an interesting dynamic. Like, you have to get out of your own head to help someone with their head.
Yeah. And it just sort of changed how I came into an interaction, and that like really helped me a lot.
So how do you come into an interaction with a patient for the first time? Do you just right off the bat
I say every time, like, it's a bit repetitive for my team, who sort of hears it all the time, but I join and I introduce myself, and I say, just to let you know, as we talk, I stutter, and I do with everyone, so just expect that as we talk, because often people think it's like something that they're doing that makes you nervous, and so I just try to not have them wondering what's happening, or that it's anything they're doing.
Right. So. That's kind of you, because it just really sets the stage from the beginning for both you and the patient.
Yeah, it's very hard to do, and I'm not sure if I hadn't gone down this path that I'd have sort of come at it that way.
Right.
So.
Right. Anything else you want to share with us that you think is important to cover? I mean, this is all really, really interesting and helpful.
Yeah, I mean, in the context of all that, I do think it's important for younger or people to try to do and engage with the things that actually interest them and not what they think they'll be able to do, because what feels hard or impossible early on can feel routine later on, and it's very easy to sort of limit how you dream based on what you think you can do.
Right. That's such an important message, and it's a beautiful message that don't let this stop you from fulfilling what you want to do with your life. You can do anything anyone else can do. Yes, it might be harder.
Right.
You may have roadblocks, but it's you are living evidence that you can do what you're passionate about, even if it involves not hiding and not avoiding and public speaking on the regular.
Yes.
So,
yeah.
Awesome. Well, thank you. Thank you, Jess, for joining us today. And we'll have to have you back. We have a whole other show that I'd like to bring you in and torture you with. So it's been great talking to you. And for our listeners, if you have any questions or comments, I'm sure Dr. Zonana would be happy to talk to you or answer questions. She's on our staff here at Silver Hill and one of our best. So thank you.
Thanks for having me.